right, guys. So this is my 12-month post Exosomes check-in. I didn't prepare anything for this check-in. I didn't prepare any notes. I didn't prepare anything. um, it has been a really crazy month. Um, I will probably have to do a separate video talking about everything that's gone on in the past month. But I was like, I just need to sit down and do this video and get it up for you guys. If you've been watching my other updates, um, you will know that I did not improve in any way from this treatment. I mean, I can't say I didn't improve in any way. I mean, my skin, I think that's the one thing that improved. And it seems like I'm not getting as many infections as I was before, although that is questionable because I have been to urgent care a couple times in the last month or so. But I have had, tests done and it isn't showing that I had an infection. So I don't really know why I feel like I do have an infection sometimes, but I can't say with certainty that the recurrent infections are completely resolved. I don't think they are. Um, I was gonna make this 1 year post exosomes thing like a big deal. I was going to do a price reveal. I was going to do all this stuff. But this past month has just been crazy. Um, there have been multiple COVID exposures, and right now I'm not out of um, I'm not in the clear yet. So I had made a video already about that, but now it's like, okay, I got to scrap that video. So I have that stress kind of hanging over my head. Um, I have financial stress. My car is not a thing anymore. I have to get rid of it. So there's a lot going on, and I haven't been able to focus. I didn't write down any notes for this video, but really, you guys, if you have been watching all of my updates, you know that there's been minimal improvement. Um, my neurological symptoms are still all there. They're the same pretty much, with the exception of thoracic tightness. I'm still having increased thoracic tightness in those muscles. I actually feel like it may not just be the muscles on the outside. I do think that there is something intestinal going on. My doctor did prescribe me Xifaxin, and she told me that I had SIBO. If you watched that video where I do the doctor update, um, you'll see that I discussed what the other doctors had told me, that I had a lot of gut issues. And so I think just to kind of shut me up, she prescribed me Xifaxin, which cost me a lot of money. And I did 2 days of it and couldn't tolerate it because it was just so hard on my stomach, which is weird because I'm pretty sure I did that antibiotic before and didn't have that reaction. So I definitely feel like my intestines or something are in some kind of distress. When I took that medication, I immediately broke out with acne on my back, and if the exosomes has done anything, it has been clearing my skin more than the gamma guard, because the gamma guard also helped with that, but the exosomes seem to have done that even more. My skin is not 100% clear. My acne is not 100% gone. You can actually see I have some here. I have a little bit of hormonal acne right now. But there were some problem areas on my back that, acne just kept coming up. And I feel like before I did the Xifaxin, it was really clearing up quite a bit. Like I was kind of impressed by it, because I go back and I look at pictures of myself before, because I would take pictures like of my back and my chest, and there you can see all of the marks of the acne, and it was actually clearing up pretty good until I did the Xifaxin. And then I've been having a little bit more of a breakout since I did the Xifaxin. um, but I still, I don't think the acne is as bad as it was. But again, my acne is not 100% gone. I can't say like, oh, this thing cleared up my skin completely. Um, I just, there's nothing that I can like definitively say that exosomes helped. Yes, they did help my skin, you know, but they didn't clear it completely. I do feel like it may have helped a little bit of the upper abdominal stuff that I was having prior to the exosomes. I was having a lot of dyspepsia and just kind of feeling gross, but it was more upper abdominal. I don't have that as much. Now it's kind of more lower abdominal, gassiness, you know, looser stools, not diarrhea, but my stools are looser than they were before. They're softer. Um, so I guess there is a little bit, some amount of improvement in my blood work. It showed that my sed rate was normal, and it's been normal on the last, you know, blood work that I've had done. But I'm still just not in great shape. Um, one of the things that I was kind of like hoping was that it would help my energy for whatever reason, because I feel like, I've read a lot of people with fatigue, they do exosomes and the exosomes help their fatigue. I don't have severe fatigue, but I do use oxygen, and I do notice, that's one thing that I feel like after the exosomes, I'm noticing the benefits of the oxygen more, I want to say. Because before, I felt like even when I would do my oxygen, I wouldn't feel that big of a difference with my oxygen. Like I was getting to the point where I felt like I almost thought that my oxygen machine was broken, and that's why I wasn't feeling that much of a difference. So I don't know if I'm just like absorbing the oxygen better or what, but I don't know. I kind of feel, more of a distinct difference when I'm on my oxygen than when I'm not on it. You know, I did have days here and there where I didn't use my oxygen and I felt pretty decent. But again, it was like random days, um, or it would be like a Saturday when I would go out to the swap meet. And, but of course, I had been doing oxygen Monday through Friday. So I don't know if maybe like my body is just holding on to that oxygen better or something. I don't know. But overall, I just can't say that I haven't improved. Like there's nothing, my life has not changed for the better. Like I want to be grateful for the tiny bits of improvement. I feel like if my skin has improved, then that means that some of the gut issues, like the leaky gut situation, has probably gotten better, but then I should be feeling improvement in my energy, in my digestion. Um, I should be able to tolerate antibiotics better. My histamine issues shouldn't be as bad. And I still feel like I am having histamine issues because I'm not eating anything that's high histamine. I feel like I tolerate sugar better as well, which is not a good thing because I like sugar, and sugar, you know, I know that it makes candida issues worse. I notice that when I have sugar, I do get gassier and stuff like that. So, yes, I may be tolerating sugar better, but that's not, I shouldn't be eating it anyways. Um, yeah, I just, I was still having the hair loss. I feel like the hair loss has slowed a little bit this month, but it kind of, that actually kind of seems to come and go. The hair loss, like, I mean, it looks kind of like I lost a lot of hair here, but I think it's just the lighting. Um, but yeah, I can't really say when it comes to PMS. Now, here's another thing that I kind of want to mention, and this is something that I'm going to bring up to my doctor because I kind of waited. I don't know if I mentioned this in my other videos, but I wanted to wait until the year was done because there were times when I would, I knew that my period was coming. My PMS can be pretty brutal, but I've been noticing, and I've noticed it a handful of times. Like, it hasn't been every single period that I've had during this past year, but it's been enough times that I can say I'm noticing something. Um, the thoracic tightness that I have, in the trunk area seems to loosen up a little bit, like right before my period or in those first days, which is really strange because I'm usually in pain in those first days. Um, and usually my symptoms are worse before my period. My light sensitivity is worse. Um, depression. The depression actually hasn't been as bad after the exosomes. I still do get it, but it doesn't seem as bad. The ruminations have been really bad, prior to my period, just that constant thinking and, going over things over and over in my head. The night sweats have been very random. So, for example, this cycle, like I'm about to start my period, I haven't had night sweats yet, and I'm maybe tomorrow, or um, I'm due maybe tomorrow or the day after. But then, when I have had night sweats, they've been very brief. Um, Sometimes light, like not a ton of sweating. And that can just be, hormonal changes because I am getting close to 40. As you can see with my gray hair, by the way, I have more gray hair now than I did when I started the exosomes. I don't know if that's an exosome thing, but I do have more gray hair. I've been getting a lot of grays within the last few months. But I don't know if that's from the exosomes. But I have noticed that weird, that the thoracic tightness does not seem as pronounced right before my period. And then my period passes and I feel almost like the muscles kind of tighten up again. Now, I kind of have a theory for this, but I am going to bring it up to my doctor and I'm going to say, hey, why is that happening? Because that's really strange. Um, you know, right before your period, and by the way, if you're uncomfortable with any of this kind of stuff, um, I mean, feel free to turn it off, but I feel like it's important because I don't know if this is some kind of a clue as to what is actually going on in my body because of the exosomes, but I usually have an increased appetite right before my period, and I'm wondering if that means that there's less inflammation, like in my stomach, in my digestive system, in my intestines, and if that could be part of the reason why I feel that tightness. So it's not necessarily tightness in the thoracic muscles, but almost like a bracing because there's something going on in the intestines. And I don't know if maybe there's some kind of anti-inflammatory situation going on before my period, because usually it's the other way around. You have increased inflammation from the what is it, progestin or something. Um, I'm not a doctor, don't quote me on that, but you typically have increased inflammation. That's why you get menstrual cramps and all that kind of stuff. And yes, I do think my cramps are getting gradually worse again because they had improved quite a bit with the Gamma Guard. So that's very strange to me that I would feel more comfortable in my muscles, particularly those muscles prior to my period. And so it leads me to believe that that tightness may be intestinal related and not so much the muscles on the outside. Um, and, my doctor put me on the Xifaxan, and I did feel kind of like increased tightness, a lot of stomach issues, distress, a lot of nausea, upset stomach, just terrible. So I do think there's something to that. I do think that there is something intestinal going on. Yes, I do have dysbiosis. I know that I have a lot of issues going on there, but I do think there's something else, because you can have dysbiosis, you can have SIBO, you can have IBSD, you can have those things, but not have leaky gut. So I do think that there's just something wrong with the gut itself. Either some kind of motility issue. I mean, there's definitely motility issues, but some kind of like wear and tear on the gut, maybe some kind of damage that, my body, my muscles are sort of bracing against that. And that's post exosomes, because before the exosomes, I actually felt a decrease when I was on my Gamma Guard. I felt a decrease of pressure, less tightness in the trunk area. it didn't completely loosen up, but it was, I was comfortable. And since I did the exosomes, it's been a whole year of just feeling discomfort, especially when I'm in this kind of a position, like a sitting position. So, it's just very, if there's one thing that I can say about the exosomes treatment, is that it's been very strange. It's kind of made everything more unpredictable. Nothing makes sense anymore. Um, I don't know how to explain it. Like, it just, things don't make sense. Whereas before, things were making sense. Like, I would eat sugar, I would feel sick. You know what I mean? Like, there was a direct correlation between things that I ate and how bad I felt. Um, there was a direct correlation between the day I did my infusion and my symptoms, how my symptoms fluctuated. Um, I would have constipation like 1 or 2 days after my infusion, and then as the week went on, it would get better. Um, so I really don't know, like, I don't know how to explain it. I don't know how. I mean, obviously the treatment was a failure, and I'm pretty sure, the video that I did where I had that appointment with my doctor, my last appointment, um, in December. I mean, I think she pretty much feels the same way, but she doesn't. It's not making any sense to her why this treatment has not gone well. Um, I have my theories, but I don't really know. I mean, like I said, I'm not a doctor, but I do think that we just may have hit the wrong target. I know that she wanted to do exosomes because they cross the blood brain barrier, they get into the brain. And I have nervous system issues, but I don't think that that's where they originate. And I do believe that there's an association, and I have to look into this more. And I might make a video on this later on. But I do think the gut and the nervous system are connected in some way. Obviously, that's probably newer science, and they don't, doctors don't know much about that, or it's kind of like an early science. But I'm starting to feel that my gut is the source of the problem. And she was aiming for the nervous system, but the nervous system is not going to stop doing whatever it's doing until the gut stops doing whatever it's doing. And that's the real challenge, because these therapies have to be targeted, and that's my general understanding from what she's told me, and from what the scientist guy, the one that this product came from. These are targeted treatments, right? If you have nervous system issues, you hit the nervous system. If you have joint problems, joint pain, arthritis, you have to inject them directly into the joints that are affected. But if you have an issue with your gut, how do you get those into your gut? My other thing too is there has to be some kind of a reason why exosomes are used in some cases and why stem cells are used in some cases. And I feel like the scientist guy told me I should have done stem cells. My doctor is like, no, you need exosomes. And I'm starting to wonder, I don't think I would have reacted well to either one, because they are very, very similar therapies. But I'm wondering if stem cells are more regenerative, like if you actually have tissue damage, um, damage in your gut. I'm wondering if stem cells are regenerative, because exosomes are just, bubbles that they improve cell to cell communication. So I don't know if that's really my issue, or if I just have some kind of damage, probably in the gut, that needs to be repaired. And I feel like stem cells are more for repair, whereas exosomes are more for, like, efficiency, running. It's almost like a car. You exosomes are like when you put oil in your car, they keep it running smoothly. Stem cells are when something actually breaks down in your car and you have to repair a physical part or replace it. um so I mean, I don't know if I'm right, because it seems like right now I was reading that exosomes are regenerative, but I was like, aren't stem cells can become any kind of cell in the body. That's what I thought. And exosomes are not stem cells. They're not cells. So, anyways, that's what I've been ruminating about lately. But that's really it. I will have to do another video with a price reveal, and probably just elaborating more on this. I just have been under a lot of stress. Like I said, multiple COVID exposures, really trying my best not to get sick. But I'm also just kind of like weary of the whole COVID thing and, you know, having to wear a mask all the time, having to do prophylactic treatments. And I will do a video about that, on another time, but I hope that this has helped you guys. I will still do some check-ins here and there. I don't think I'm going to be doing check-ins like every month anymore because I feel like it's been kind of depressing, and I actually wasn't really even looking forward to doing this video. There wasn't really even much to say in this video. This month was a hot mess because I was doing those antibiotics. I think I did them for 2 days and they just kind of threw everything off. So there wasn't really anything to report except side effects from those antibiotics. So, I will keep you guys posted. If you guys have specific questions or you want me to make a video specifically about something pertaining to the exosomes or how I reacted to them, you can ask down in the comments. But don't take this as, not everybody's going to respond the same way. I am seeing other people, because I am in the Exosomes Facebook group, I am seeing other people that are also not responding well to this treatment, other people with Lyme disease. So I think as more and more of us try these treatments, we will see more treatment failures. Yes, there are treatment successes as well, but I am seeing now, as time is passing, there's people that are like, I'm 8 months out of this treatment and I'm not feeling well. I'm doing worse than I was. So, I think the reason why we're not hearing too many of those stories is because not a lot of people, and people that specifically have Lyme disease, have tried exosomes, and now people are doing them because it's kind of the big thing right now. It's a big thing until enough people fail on that treatment that doctors just, they just shut up about it and they don't offer it anymore. So that's what I have for you guys. I'm so sorry. I just feel, it's sad. I feel like a failure. I feel like this should have gone better than it did, but I don't know. I haven't given up, you guys. Like, I don't know what it is. Like, I just refuse to give up, and I refuse to stop trying different things. I tried the Xifaxan. That didn't work. I'm going to try some other stuff, but, I'll keep you guys posted. If anything changes, I will make a video, and I'll let you guys know, but at this point, I really feel like it's kind of a done deal. So, anyways, thank you so much, and I will see you guys again soon. Take care.